there's a lot of research that's going on. There's a lot of efforts that are going on to be able to get into how you use data analytics to get to predictability, which is extremely complex. But that area continues to evolve, and there are more and more opportunities coming into place. So from that standpoint, I guess this is a great example for a very well built data lake and AI and ML capabilities, where you have both structured and unstructured data. From a patient administration, demographics, profiling standpoint, you have quite good structured data. But when it comes to your diagnostics, your treatment, it's a huge combination of structured and unstructured data, because you're going to have to kind of combine the images, the cohorts that contain the markers and stuff like that with structured data to be able to get to that point. So very huge area of opportunity, but at the same time, very high complexity as well. So what we are starting to see in that area that are more actionable at this point in time is picking specific use cases in those areas. With regards to, for example, I'll take radiology images, and there's a lot of effort and a lot of products out there that can get to some kind of predictability based on the images that come out of it. So and so that's where we're seeing a lot of improvements. Moving it backward and still sticking with patients and patient experience is the internal operations of the hospital, and how we enhance the patient experience both in and outside the hospital. So that's the operational area, but within the hospital, that's another second area of huge opportunity that we see with data and analytics. And this is mostly structured with regards to, how quickly are we getting the patient in and patient out? What are the wait times? Are we able to get them to the right doctors with the right appointments? Are we able to get the patients discharged on time? So all these performance indicators, become a really good use case for data and analytics. So that is the second area, and the third is internal to the enterprise overall, is the business side of the whole things, with whether it's MISs or dashboards, and that's one of the areas where I would say is becoming more and more agile. We've seen the change in environment, we've seen the impact of COVID. So the indicators that would get to the outcomes that you would get to are continuously evolving and changing and not really constant. So there are a lot of parameters that are coming in, a lot of parameters that are coming out. So building a analytical dashboard that is very agile, that you can plug and play, and if we can get to predictability, I think that's the third really good area of opportunity we're seeing from an analytics standpoint. To answer your second part of the question with regards to data privacy, like you said, I think it's evolving, but there are really good best practices across the globe. I think GDPR and in Europe and the US regulations kind of lead the pack, and if we can kind of draw from those learnings and apply this, I think there is a huge opportunity to be ready for whenever those regulations come in. What we are already starting to do is there are some non-negotiables, right? So from a data privacy standpoint, consent forms, patient consent forms, understanding the data that is supposed to be categorized as private. So PHI information is just personal health information, and the personal PII information, which is the identification of the person. Those kind of indicators, if we are able to segregate that and look at how we do analytics through a cohort of data that really cannot actually be traced back to personal information, I think that's where we're going to be able to get to a point where we're going to be ready for the regulations that would come up. All said and done, but when the regulations do come up, we have to comply with whatever they come. But at a broad level, I think this is where it stands.